drainage area inspection khutum hoise aru ami khan etia Niathu resort te agina ase aru ami khan khobor pai ase ki urban development and municipal affairs advisor Shri Zhaleo bra yate media khan ke press meet ekta dibole ase kushe aibi ami khan itula opor de detailed report huni sabo.
Today is the second day of inspection of Dimapur town, starting from yesterday, including today. The 2 days inspection, I think by and large we have covered the entire Dimapur ward areas, colonies, and the purpose of this visit was to find out whether the drainages are in its proper shape and also to assess requirements of drainages, because Dimapur every year has been afflicted by flood, particularly during the monsoon season. And my team, which includes Deputy Commissioner and his officers, then from CP and his officers, then from Medical Department represented by CMO Dimapur, and from my department it is being led by Commissioner and Secretary, Urban Development and Municipal Affairs. So also the Director of UD and Additional Director, Municipal Affairs. So before I proceed, I should also thank not only the Global Window, who has been giving this 2 days coverage, but to all the departments for coming forward and supporting us and also taking the joint exercise together. During the inspections, we have come across that many drainages are in place. In other words, whatever necessary infrastructures were to be constructed, it has been constructed. Only few areas there is a need for new construction that will be looked into. But it is very sorry to say that our drainages are in place. But in spite of conducting various IC campaign or awareness programs, education program, I think our citizens, they are still yet to come up to expectations. So it is my humble appeal to our citizens of Dimapur particularly, since we are talking about Dimapur. I think we should also inculcate healthy practices, good practices of disposing our garbages. So also maintenance of our drainages and also proper care of disposal of garbages. We know DMC on daily basis, whether rain, sunshine, winter, summer, monsoon, they are all the time collecting garbages. And normally they collect in the early hour of the morning. Daytime, because of traffic congestion, the vehicles or machinery cannot be put into work. But with that limited time, I find that DMC is doing very well under the stewardship of present administrator, Sri Mpai. And also, there are many things in the pipelines. We will be also taking up development works on the Amrut program. So also ADB, that is for the Dimapur district headquarters. But when we are experiencing all this flood every year, I know the effect of climate change is there also. But here, after having done all these basic requirements like drainages or roads or whatever, unless our citizens, unless our people also come forward and make it a culture of cleanliness and disposal of the garbages. See, we had gone to 3-4 locations, the drainages are in place, and even we had come across 2-3 locations. The drainages where garbages were accumulated or where siltation has taken place. DMC, with their machineries, they have removed all those garbages, siltation. But after having done that again, today is very sad to know that again the same accumulation of garbages, the flow of plastic bottles, all waste materials are there. So I want to take this time to once again appeal to our Dimapur citizens to inculcate that good practices, good habit of disposal of our garbages, and to maintain clean and healthy life. What government is doing, what the urban local body is doing, this is for the general welfare of our people. But if our environment is polluted, if they are kept unclean, see, recently we're having experienced this dengue virus. Why we have taken medical department along with us in the team? Because this storage of water or drainage blockage, all these are hotbeds for mosquitoes to lay eggs. And this virus is being transmitted through mosquitoes, that we all know. So when our health is infected, everything is impacted. Our economy, then health. So I'm very happy, and I also would like to appeal to our media that you have been doing a good job. So even through your media, you should also give a lot of publicity, and together, if we can continue to build up this awareness program, education, and spread the message of cleanliness. Cleanliness is health. See, it is also not only it covers our health, but economically or environmentally it saves everything. So this 2-day trip, I'm overwhelmed with the support and cooperation of all those who have accompanied the department, and I would look forward to such support and cooperation in the near future. Then we have seen there are also standing structures blocking our drainages or even encroachment here and there, and also unauthorized or illegal constructions coming up in market areas. So even yesterday I also have communicated, but I still have a request to the district administration that the DCM team, the land revenue, all this, as we have discussed, I also want you to initiate action. But I think we should not hurry-burry, or so I would still also encourage the carrot and the stick policy. Let us apply the carrot policy by requesting the ward leaders or colony leaders that, and we should give them a time frame to remove all those unauthorized or illegal constructions. But if it fails, like I have said yesterday also, the law has to be applied, and even by means of force, we have to also demolish, dismantle, or remove all these illegal construction. Because these are coming in the way of our smooth flow of our drainage waters. So with these few words, I think our trip has been very successful. And in token of our joint visit, I'm still requesting Administrator DMC that in that Kivija colony, you should organize a social work. You press your machineries into works to remove those accumulated garbages and siltations, and that is one. And I also request the engineering wing. We have talked about the construction of one culvert. So that you should prepare a detailed estimate. And otherwise, we have done a lot of coverages, a lot of publicity, and we mean business. So those few important things, in the name of our visit, let us come up with that. And I'm happy all the mission directors, whether Amrut or our director UD is here, additional director Municipal Affairs is here. So the verification what we saw actually is a very enormous task. So things cannot be solved overnight. But whatever infrastructure are there, if this can be properly maintained, and if new developments which we are contemplating to take, if they can come up, then I feel it should solve a lot of problems for Dimapur town. And Dimapur being the commercial hub and gateway to Nagaland, I think we have to not only develop the town, but we have to also show its beauty also to the outside world. We have seen those illegal construction. They have become an eyesore to even the Nagas, to all of us. That what impression will be creating in front of people coming from outside the state? You can imagine. So it's in a very sorry state of affairs. But hopefully, and with the cooperation of the citizens and all stakeholders and government department, we hope that not before long, Dimapur will have a new face, and it should be the pride for Nagaland. Thank you.
Sir, it's a 2 days visit. For seriously government issues waterlogging, the effort there can be keep by say. Will it be, sir, illegal construction mapping to Kundawala Chulawa, sir. Resettlement of 2000, which is approved by the government of 2005 and 6 wala Chulawa, sir, Kundawala Chulaina, illegal construction can demolish Kurude, initiate global, sir.
No, in brief, what I can say, maybe my administrator can supplement, but we're talking about Dimapur Municipal Council. So whatever area falls within the jurisdiction of DMC, we will go by that. And basically, being Urban Development Department, our focus, our priorities, the urban areas, which comes under the jurisdiction of Dimapur Municipal Council. So as I've said, I want even DC to supplement. But whatever we have identified, see why I said carrot and stick policy. Let me be frank. Sometimes if we take direct action, in Dimapur it is, I think, a regular feature. See, many goes to the court and they bring stay order. So we also want to be a bit diplomatic on that issue. So maybe you want to give the local level authority to settle all these things. But at least in Dimapur main area, like the New Market, Hong Kong Market, or your railway areas, that the district administration and the DMC will come direct. I'm just citing an example like our Angami Signal Village, Kevijo, those are exceptional cases. Otherwise, we will directly apply our own government powers.
Sir, apni sanitation area, drainage area visit kramde aji apni surprise new flyover rail gate and then rail bazaar area or Hong Kong market area de apni visit korise. Aro sir tadi illegal construction kan to bhangai digina parking lot kan banai dibi kwala opore sir apni lo elaborate kori dibo.
No, see, today we have just run through, and we all have seen many illegal construction. But in that regard, I'm entrusting the administrator we have to first identify who are these builders and whether they have any permission to construct such thing. So we'll have to identify then who are behind all this. Then only we'll take a gradual step. But as we have noticed, I think we cannot allow such a thing to go on. That must have been going on for many years. But we're all sharing the same view. We have to remove those illegal constructions, and those can be created into parking of shoppers, private vehicles. But we have no parking space also. Our roads, which is for vehicle mobility, they are all being used as parking. So no vehicle is moving. No traffic is smooth. So by removing all these, we will be able to create a lot of parking spaces.
Sir, Dimapur traffic congestion do din por din buri ase aro government rabi to laga pore seriously concern ase aro not forgetting Dimapur traffic police commissioner police rabi bishi effort di ase believe sir through urban development and municipal affairs pra sir flyover nutun construction kumba koribole aro parking lot sir dusra state de nishna parking lot jundo DMC urban development pra new market de bunai deshe itu rabi subida bishi hoise. So urban development process future de inika buna boli laga kumba plan up ayase na sir.
No, actually way back in 2013-14 incidentally I was also looking after urban development department. During that time actually I planned to develop 2-3 flyovers, but we had run into a political crisis. So voluntarily I have come out from the government. But I thought even after my departure, I thought department should continue to pursue those. But after my departure, there was no continuity. But we have been discussing also. But definitely we need more circular roads. Then our remedial measure may be to come up with more flyovers. So department we are making a study. But we also have seen, even inside our town, there are national highways, roads also, and only very recently, urban roads have been bifurcated from our PWD RMB. So we're in the initial years. We still haven't got any separate urban road funds. But after I took over, we have started to venture to access fund. We do not know how long it will take or how early, but once we get the required funds, we will definitely look into all these requirements.
Sir, major concern drainage block we can visit 2 days visit the dikhi palo plastic bela bishi dikhi paise DMC urban aro administration rabi to laga pore strictly warn kore ase public kan ke aro business owners kan ke utilize na kore olive market le constantly chulai ase to aro sir business owners kan aro market de bua kan roko ase ki takan wholesalers khuli gina takada bikri kura takan polythene bags to purchase kore ase so itu laga pore department and then if district administration rabi to laga pore answer to party.
Yes, regarding the wholesalers, time and again, in fact, we have formed vigilance teams because in single-use plastics, and there are a list of items which have been notified by the Urban Development and Municipal Affairs Department as well. So we have a vigilance team comprising of administration, police, from DMC, as well as also GBs and colony people, and we have been raiding also. We have been conducting raids also on a very frequent basis, even fortnightly basis also teams are going, and many of the wholesalers also have been sealed also. So people may be taking some pretty excuses also at times. Of course, the problem is availability, but it has also been come to our knowledge, and even retailers are going to Assam and procuring those plastics and coming inside. So, of course, these vigilance things, these checkings are always there, these teams are always there. But why are we going involving the GBs and the councils also, is to create the awareness. Because whatever podium, whether we get also, and when we talk about these blockage of drainages or this urban flow spurging in our towns, we always mention about these plastics. So unless and until that IEC, that responsibility is felt by the people, I think it will be very difficult for a handful of officials to go and check each and every shop. Of course, penal provisions are always there, and we have been penalizing people also. It's not that we are not being doing, but then unless and until we realize these opportunities and we shift to those alternatives which are available, which are the green material which are available, I think unless and until we realize and we discourage ourselves, even consumers also, when we go to the shops, we should discourage ourselves also. We should take cloth bags and purchase our meat and sabji. I think that will only in the long run will solve this plastic menace. If administrator also wants to supplement anything.
Yes, as far as the single-use plastic is concerned, the CPCB mandate is also there, Central Pollution Control Board, and as our DC sir has said, it's a regular activity that we undertake, the checking of the plastic. But now, side by side, we also really have to examine and find out alternative to the single-use plastic. I think that is very important and crucial point, because practically if we see in the market, like to substitute for the single-use plastic use in terms of handling wet products like meat and fish and all, this becomes very crucial. So the biodegradable kind of plastic grade poly bags are also available, but how far they are certified by the Central Pollution Control Board, that also need to be examined. And I think at the state level also the move is there to identify such registered product which can be used as a substitute for the single-use plastic. So that is it.
I have one question. This is for the DMC. We have observed, noted over the years, waterlogging flooding in Dimapur. I mean, it's not only related to encroachment on public roads and drainages. It's also very much related to throwing of solid waste material into drainages. Now, is the DMC or even since the advisor in charge is also here, is the government in particular doing anything for, thinking something serious to seriously tackle waste segregation, encouraging waste segregation? When do we have it? I think it's time, because we have been talking about this for many years now.
Yes, today's exercise under the initiative of our Honorable Advisor, we have had surveyed the important drainages in under DMC area. But as you have mentioned, this drainage issue, the flooding issue, it is not a single standalone issue, but it has many related factors like the garbage collection and the solid waste management under municipality. So which cannot be, we cannot find a one-stop solution overnight. But on the part of DMC also, we are in the process of finding out the flaws, what inefficiencies in the present waste management system is there. We are finding out, and one thing which we have identified is, as our advisor sir has also mentioned, the collection time of the waste. It is very limited to the morning hours. So within the time span of 3 hours, we are not able to cover the whole municipal area. So identifying that issue and plus with the site visit from the other municipality where the solid waste management is going on in a better way. So what we could identify was to have a smaller vehicle so that we engage our waste collection multiple times throughout the day. So under that, DMC also have moved with the government also, and through various means we are trying to obtain those vehicles to be used on a pilot basis through to some identified wards. So very recently also our Chairman DPTB has been kind enough to sanction some amount out of the common pool, which we have proposed for procurement of such a vehicle, the smaller vehicle, customized smaller vehicle. And so also from the department side also, we have made some arrangement under tight grant also to procure some vehicle which is immediately of necessity for the DMC to try out this waste collection module. So under the planned state waste collection module, we are focusing on having segregated waste collection so that the smaller vehicle which we are going to engage, they will be purely for the wet waste collection. And the dry waste, as we all know, like it can be bundled up and taken care as it is happening now. Now also our vehicle, we are not able to collect from each location on a daily basis. So these are some of the issues that we are facing at the moment. So with the introduction of the smaller vehicle, we are hoping that our coverage for waste collection will be on a daily basis in terms of the wet waste, and we will continue with the usage of the bigger vehicle to collect the dry waste on maybe alternate days. So to start with, we are planning on that line, and we are hopeful that with the support from our LADP and from the Department of Municipal Affairs, the DMC will very soon have those required vehicles in our disposal so that we start off with our pilot project.
Madam, Dimapur de এতিয়া dengue outbreak to epidemic বনাই দিছে আৰু দিন dengue লগা বিমাৰ পৰাটো আমি খান শুনি পাইছে ওলিবি district hospital project to resolve খান দে এতিয়া লাগ dengue পৰা মৰা লগা দেখো নাই গৈ ওলিবি outside to the perimeter of the district hospital records বেছি শুনি আছে, and then not only that blood bank blood shortage হোৱা বেছি পাই আছে. So how do we overcome and tackle this, man?
First and foremost, I think the dengue being an epidemic was not announced by our department. We have definitely not said it's epidemic, and so that's one thing I would like to clarify and once again re-emphasize that dengue is not epidemic. There's been a surge in the cases of dengue, yes, this year as compared to last year, and so dengue cases are there. It's more than last year, but as of now. For dengue, there's a rapid antigen test, like COVID times, the rapid antigen test, and after that we have to confirm it through ELISA to make sure that it is a dengue case, because there are incidents of false positive. And so likewise, all the cases with dengue-like symptoms are being tested through RDT, and once that is done, then after that we are sending the samples for confirmatory tests. So out of that, the confirmatory tests, out of those that have been sent, the samples that have been sent, it's around 14 to 20, between 14 to 20% of the cases are dengue positive. And so the deaths, like you were mentioning, the deaths that have happened are not on that line list. And so that way we cannot label it as a dengue death because their tests have not been, they're not confirmed as dengue. Now, there is the enterovirus that is going on. I think it started off with conjunctivitis also. We had sent it for serotyping and it had come out as enterovirus. So these are all the symptoms that come. They're all very dengue-like, those who are suffering. It's a viral infection. And so likewise, there's dengue is getting a bad name because of this, because of the similarity in the symptoms that patients are coming with. And so likewise, we have to be able to be we have to distinguish between that. Now, where blood is concerned, usually for platelets, dengue patients usually within after the 4th to 5th day, even though they're not, the fever is gone, they do, many see a drop in the platelet count. And so we monitor this platelet count on a daily basis to make sure that it does not go beyond the critical level. So if a person is healthy and fit, eating well, keeping themselves well hydrated, then we don't expect it to drop below the critical level. They can manage. Even if it's going down 20,000 also it's okay, 15,000 also is okay. We just observe to make sure that the patient, whether if there's no bleeding tendency and the patient is eating well, then usually we just observe and we don't really go we don't ask for blood. But then now dengue has this panic thing. If it's going down below 20 or 40, even 50,000, they're looking for blood. Relatives are coming forward to donate for blood donation. And so this is one thing that we would also like the public to know, that we should not panic so much. I think it's okay, we've got it under control, but then when it is needed, then definitely they will be informed about the need for for blood. For platelets, we do not use stored blood. That is one thing we have to know. We don't use stored blood. We need fresh blood from where we can extract the platelets. And so that is why I think shortage of blood, as you're mentioning, is there in the blood bank. We need fresh blood. And so that is where people think the blood bank has got no blood and all that. But for others, where platelets are not concerned, the blood is there, but then for platelets too, usually we need fresh blood. So it will depend on the patient and on the donors that are there. And so I think we have to be very clear on that part. See, it depends on the patient. If the patient, because it's not one patient, one platelet. Okay, one patient may require more platelets than another patient, depending on the comorbidity that the patient is presenting with. Or the patient maybe is having some sort of bleeding for which we may require more. And so age and comorbid conditions, and then the condition of the patient. According to that, some patients require maybe 5, 6, some may require around 10 or maybe even more units of platelets. And so depending on that, just because there's around 100 platelets that have been demanded, it does not mean that we've got 100 patients. That 100 platelets will be maybe for maybe 10 patients or maybe even less. So far, the records that we have and the reports that we have received, because we are asking them on daily basis as of now, the dengue response team of Dimapur has also been formed, and so likewise that also including all the private hospitals. And so along with that, any case that they find positive, they're sending us the sample to the district hospital to run the ELISA. And so likewise the ELISA test is being run. And so as of now, I don't think any cohort or anything like that, we've not looked into that of having some sort of cohort exercise or under a thing to check and all that, because we are receiving the samples from the respected hospitals. For that, we'll have to look into that, but as far as we know, the line list that they send us of the dengue patients, because they're supposed to be reporting, dengue is also a notifiable disease, just like malaria, so they have to report, and so we've got a line list. And so when they take out the sample for testing, usually they send the same sample. Okay, they will not take an extra sample and all that and collect it. When they collect it, it will be together. And so likewise, the samples that we have received are, it's correlating with the number of cases that they have in that reported from their centers. So likewise, if there is, then we will look into it. We've been told that there are patients who have not brought the samples. The samples have been given to them to bring it to the hospital, but then it got lost halfway. They have not brought it to the hospital. For those who are okay and fit and who can be treated at home, so I think depending on whether they've got manpower shortage, well, there is certain protocols, and we do where there is need, then they will have to let us know that it can't be collected. But then, as of now, no one has asked us to come and collect from the other, say from the other blocks or from the other districts. We are doing the needful where they say that we have got the samples collected. If we can send somebody to collect it, then we have got everything ready. So likewise, that communication is open, and so that way, I don't think right as of now we're having any issues there.
So, ma'am, in short, Dimapur is thinking of a search for a panic group, wake up, alarming economic.
Alarming to Ikunai. As of now, cases are, we've been looking at the cases, the numbers that are there, and so if anyone is not well, they need to come to the hospital earlier than later. Bishi deri para ha bishi ase. Done. So if they can get themselves treated early, tested early, then that way we can intervene earlier, and likewise steps can be taken. And so many a times we like to suffer at home only, and they don't want to come to the hospital, or they don't our health-seeking behavior. We need to improve on that. And so I think otherwise, so far we are managing. It's manageable, and it's okay. There's nothing to panic. And so here actually the department is doing a lot of activities concerning dengue for the last 2-3 months. And so we're doing a triple-pronged approach. We've got the awareness programs going, we've got the fogging going on, we've got and then we've got the treatment going on. So those who are sick are being treated in our health units, the doctors are treating them. Where awareness is concerned, we've had a lot of awareness, there's been a lot of awareness programs. Even with the municipal, we have coordinated with them, we've had the GBs, and with the community leaders. Those exercises have been taken, we've had practicals shown to them. Likewise with the teachers, college teachers, school teachers, we've recently conducted with collaboration with the CRS, and then after that, it's an ongoing. With all the wards, we're doing that. We had an exercise where we had gone house to house visitation. We had thinked up our teams of positive, where the positivity was very high. So likewise, there we had gone to houses. And then I think our administration, DC, has also already given out advisory on that everyone should be keeping their house dry and clean, and that should be done on a weekly basis, if not more often, but at least their own homes. So likewise, this all comes down to the mass movement. Public should also participate in this. This is what we want, the participation of each individual in making sure that the breeding area spots for the mosquitoes is eliminated. And so if we can do the source reduction in our own homes and in our compounds, then I think dengue will be well under control as well. And so likewise, we have been showing them where the spots are, where to look for the mosquitoes, where they breed, the breeding places within the house itself. Say many of times we don't look at our fridge water, the drip drain of the fridge. We're finding a lot of mosquitoes breeding there in the respective houses. We have flower pots, we've got the tray there, we're finding a lot of larvae there as well. Now fogging is going to get rid of only the adult mosquitoes, but not the larvae. So this is one thing I think we all need to know. So if we clean out our house, within our house, then we're killing out the larvae, so next generation does not come up. Dengue mosquitoes, they bite not just once, but several times during the day. So, and then a dengue mosquito will lay dengue eggs. So this is the thing, the peculiarity of this dengue virus. And so it's got this ovarian, the transmission is there. So a dengue mosquito, adult mosquito, female mosquito will lay dengue infected eggs. And so likewise the larva that is coming out does not need to be infected by anyone, they're already infected by So this is where source reduction is very, very important. And so this is what we are trying to advocate to everyone, that if we can do that in our own homes, then I think we'll be okay.
Sir, Dimapur recently, Bishi Chor Laga cases ulai. Our Bishi Bak Chor Laga cases this idea, sir, drug abusers, substance abusers can again. And it has been become very common with the school, high school kids and college going. Pachakan Bishi drug substance chulala ho politics. So Commissioner Police Office Professor, itu kan lukhabu gorni sir. Measures nutun kumba lobole koshish kore ase na colleges kan dibe awareness kumba create korle sir steps lo ase na.
Thank you. We are very concerned about the drug abuse that is happening in our society, especially Dimapur. So most of the theft cases, you are right, are being committed by the drug abusers. So our police headquarters also, we have declared a war on drugs, and we all the Nagaland police in all the districts, we are giving our best to put an end of these drug menace. Especially in Dimapur, the highest cases of crime that is happening is the theft cases. So now what we have come to realize after putting a lot of efforts to contain drug addiction is that the drug supply is coming from especially from neighboring state Manipur, and now our effort is to trace these people who are supplying drugs to our state. We are not cultivating drugs, but then it is a transit route. Drugs are coming to Dimapur and being supplied to our youths, to our school children, and being transported to other states. So we have come to realize that. And now our effort is, of course, to put a stop on the sale of drugs in Dimapur, but at the same time, the root of the problem is to stop the suppliers from coming to Nagaland. So there's an effort. So we are working 24/7 with our respective DGP, and every day we are doing operations. And right now we are successful in catching those main suppliers also. Yesterday also we have arrested one supplier from coming from Manipur. So we are using more of the electronic surveillance and investigation, and we are getting a lot of experience from them, and we are tracing back all these main suppliers, and we are able to know where these drugs are coming. And we feel that once this supply chain is being cut, then definitely the drug abusers will come down. It will be easier for us to tackle, and at the same time reduce the trafficking in Dimapur. And also at the same time, this will reduce crime in a Dimapur town.
Sir, DGP has clearly given the press statement. That we see clearly that police department there, police can mudu chula hobi, drug substance chula shebuli. Itu kan to strict action do. So CP office there sir, police personnel can be itu kan intoxicant substance chula kan dikhi ase public kan. So how serious is the CP office? Aro sir, apni kan bi takan ke ekta chances ekta to dia ase na na takan ki rehab de jayina takan life to change kurina ai boli laga. Neli to kana kata mo podi bi sir, CP office par ki initiative le sir.
Yeah, the department is very serious, and our DGP has taken the initiative to stop this drug addiction within the police fraternity or police personnel. So he has issued an order where those who are into drug addiction should just come voluntarily and submit their names. And this is being issued to all the units within the Nagaland police. And so, of course, coming specifically to Dimapur police, we have issued order to all the thanas to submit their names, and they have submitted their names, and we have issued order to we have directed them to undergo rehabilitation within 7 days, and many names have come forward, and they have voluntarily what we call it, they can leave to go under rehabilitation. Yeah, that is being done. That is being done.
So, sir, last question. Police department is, sir, Nagaland compared to any other state, Nagaland bishi ase koe. Will be shortage of manpower laga amikan bishi honi pai ase. Aro Dimapur Commissioner Police Office pra bhal kam kura amikan bishi dikhe, but shortage of manpower bishi honi. But whereas, sir, amikan honi pa do global window pra police personnel, special constables kan attachment de likhi kina rakhi kina काम दिन आए कि ना तंगा खा बिशी ऐसे कोई ऐसे सर. So it will what be CP office be how serious you are in this matter, sir?
Dimapur Police, we are one of the most busiest unit in Nagaland Police, so I don't see anybody taking leave or being attached to any VIP or any police officer, except whatever we are being entitled like a cook. Besides that, nobody is taking rest. Everybody is busy. That is not true.
Thank you, sir.
Thank you so much.
See, the segregation plan will be of different modules and the different capacity of segregation, and some are manual, partly manual based, some are more towards automatic. So the variation of price will be there. So
do you have a range? They start from
some of the basic model which we do have the quotation from them. Their quotation figure is somewhere 2 CR, some 1.5 CR, like that. But depending on the actual the capacity, the design, the prices may vary.
So what capacity would Dimapur require? I believe our waste collection is around 100 metric ton daily.
Yes, our fresh waste collection is at the moment, as per our last assessment, it has come down to 84, but now purely speaking on the quantum of waste generated, now it has to do with the collection system also. So maybe that assessment may not be that accurate if we beef up the actual collection system. So it may be around for Dimapur it will be more than 100 tons per day. But now DMC, when we talk about waste management for DMC, now all the peri-urban area also comes in. So we have the area beyond DMC jurisdiction. But at the moment, those villages like Kuda village, like Tiger village, or Auyamti, this Purna Bazar, and even the East Dimapur Town Council area, all the garbages are dumped in our present DMC dumping site. So we cannot actually now say how much of quantity if all these waste are put together. But the segregation, of course, that is there, but waste segregation plan. But now we have to talk about segregation at source, so that until and unless we start segregation at source, it will be a very mammoth or a difficult task on the part of any municipality. So where waste segregation is going on smoothly, we see that source segregation is very important. And for this to initiate this source segregation, again, the cooperation and support from the public, each and every individual household, they have to cultivate this source segregation. Then only at the municipal and the town level, we can smoothly execute the waste collection as well as the processing system. Then now for Dimapur, again, the apart from the fresh waste that is generated on a daily basis, we have a huge pile of legacy waste in our dump site. So that also has to be addressed immediately. So these are few things which are, of pressing requirement at the moment for DMC.
You know, our state is a resource crunch state, but whatever is possible, we have to seek the assistance of Ministry of Urban, and we have been exploring also, and we're also thankful to Government of India. From time to time, we're also getting assistance from them. That is how we are carrying on with the activities of the department, and we will surely try. We have been exploring. We all can expect the best. Department is there to oversee all these things.